So today AET1 has been dispatched to a purple call. The report is a 76-year-old male who was seen in the park and has since collapsed. Bystanders have been unable to get a response out of him and have since started CPR. Just thinking about our scene safety for ourselves and the patient, so obviously we want to maintain a safe scene. So we want to ensure if there's any hostile bystanders or animals around that we remove them from the scene, and just ensure that we've got a nice adequate space to work with this patient. We've also got our PPE in terms of safety, so we've got our boots, our gloves and our glasses. Otherwise I'm happy to enter. Maddie, do you feel safe to enter the scene?
Yes.
Alright, let's enter. Hello guys, I'm Chris, this is Maddie from the ambulance. We're going to take over CPR from you, you've done a brilliant job. So patient's clearly in cardiac arrest, I'm going to start CPR.
Yep.
Yeah, Maddie, if you can get the paddles ready for me.
Yep.
We're going to pop it in manual mode and we're going to charge at 360 joules. So it appears all the bystanders have now backed off, unfortunately, but if any of them were to know the patient personally, we could inquire about a history for this patient as well. Lovely, so once you've got that on, we'll hit charge and we'll have a little look at his rhythm.
Pushing charge.
Lovely, so once that's ready, you can give me a shoulder tap and we'll just hit pause.
Yep.
And we'll just see how we're going.
Pause.
Lovely, so that's VF, looking, shock.
Shock.
Continuing.
Continue. Eventing.
Alright, lovely. So that was at 11:30. So we're going to reassess at 13:30. Lovely, yeah, Maddie, can you get a patient for me?
Yep.
And once you turn off that alarm, I'll just get you to call up comms as well and
Yep.
just confirm R49.
Cool. AET1 to comms. Patient confirmed R49, requesting R50 backup.
Lovely. Now it looks like you're really on to it, Maddie, but yeah, if you can get an airway ready,
Yep.
we're going to do an LMA. I think for this patient we'll probably use a size 4, which we've
Yes.
got, so perfect work. And then we've got our filter.
Yep.
We've got our end tidal already attached, so it should already be calibrated, which is good. And then yeah, pop on the colts, we'll attach up the BBM, and we're going to run that at 15 litres per minute.
Yep.
And then just with your ventilation, Maddie, it doesn't look like we've got a vent light, so in that case you can just go off the monitor.
Yep.
And we're just aiming for every 6 seconds, every 10th compression.
Yep.
So we're going to maintain continuous compressions. So while we're setting up our airway, we just want to consider our ABCs. So we're maintaining this patient's airway with our airway adjunct, our LMA. We're about to assist with their breathing once we've got it all set up. And we're maintaining circulation by doing our CPR. Lovely, Maddie. So we've got 30 seconds.
Yep. Oxygen's attached.
Lovely work.
Looks like you've got equal chest rise and fall.
Awesome. Yeah, no, I don't feel any clear resistance, so that's good. Cool. So we're going to hit charge in about 15 seconds.
Cylinders on 15 litres of oxygen.
Lovely work. And using the rule of threes as you're doing.
Yep.
If we were to have any issues, we could use the RODS acronym and try and troubleshoot, but
Yep.
we're getting no serious issues. So you can hit charge for me now, Maddie.
Yep. Charging.
The same idea, we'll pause and we'll have a look at his rhythm. And we'll see if with a shock or not.
Yep. Pause.
Pausing, so that's VF, shock.
Shocking. Continue.
Thank you, nicely done.
Eventing.
Lovely, so that was at 13:40, so we're going to reassess at 15:40.
Yep.
So Matt, if you're ready, you can come around to the side here,
Yep.
and you're going to take over
Check
CPR.
patient.
Don't worry about the alarm, I can turn that off for you. Nicely done. Alright, so when you're ready, I'll count you in. 1, 2, 3. Nicely done. We'll just turn this alarm off.
Thank you.
Alrighty. So we're now managing his airway. We've got the LMA all set up and ready to go. And we're going to go off every 6 seconds. We can go off the time of the monitor.
Yep.
So just thinking about our possible causes for this patient. So we want to think about our 5 H's and our 5 T's. So thinking about our H's, we've got hypoxia. We're currently managing this with our BVM. We've got good ventilation, so we've got high flow oxygen coming in, so we're managing that. Hypothermia. It's a nice warm day and this patient's warm to touch. If we had any concerns, we could think about putting a blanket on this patient. Hyperkalemia. It's not something that we can assess at the moment. This will need to be investigated in hospital. Hypovolemia. We can't see any obvious bleeding for this patient. So again, we're not concerned here. And if this patient is acidotic, so again, this is not something that we're going to be able to assess right now. This will need to be done in hospital. Thinking about our T's, so we've got our trauma. The patient doesn't appear to have undergone any significant trauma, so no concerns there. Toxins, we can't see any evidence of an overdose, however this is also not something we can rule out at this stage, so again this will need to be investigated. We've got our tamponade, similar prospect, we're not going to be able to assess this right now. Tension pneumothorax, as Maddie said when she was setting up her airway, we've got nice even chest rise and I'm not feeling any resistance when I'm ventilating, so we've got no concerns there. And thrombosis, thank you Maddie. Thrombosis we're not going to be able to assess right now, this will need to be done in the hospital. Alright, lovely. Right, it's from me Maddie, I'm going to charge. Same thing, I'll give you a shoulder tap and we'll assess. Alright, so pause.
Pausing.
ACEs, we're jumping, continue.